Hi, my name is Kristen Welbeek, and I'm going to talk about anxiety disorders for my presentation. So I thought I would give you guys a broad definition, and then I would dive deeper into the topic. A person who shares a excessive amount of stress, anxiety, and fear. Responses include a increase in their heart rate, profuse sweating, heartburn, headaches, or body aches, gastrointestinal problems, and nausea. Types of anxiety disorder include generalized anxiety disorder, panic disorder, social phobias, separation anxiety disorder, and then specific phobias. And then why it is a significant public health issue? Well, it's impacting children's psychological health and social functioning between ages 10 to 24 years old. Anxiety disorders have a heavy burden on children's multifactorial, genetic, biological, and environmental. If anxiety disorders are left untreated, it can lead to impairments in adolescents, schoolwork, socializing with family members, and socializing with their peers. And then for health equality, I found the Affordable Care Act. The Affordable Care Act ensures all individuals, regardless of their race, socioeconomic status, or background. For statistics and trends, I found anxiety disorders have increased from 31.13 million to 45.82 million from 1990 to 2029. In 2021, global prevalence of anxiety disorders started in ages 5 to 9 years old, and then it has peaked between ages 25 to 29 years old. In 2021, global anxiety disorders have reached the highest between ages 10 to 24 years old, and then women are more likely to have anxiety between ages 20 and 24 years old. Anxiety disorders are found in children who are experiencing poverty and lack of malnutrition. And this is happening for children, and they are likely to have anxiety disorders and cognitive impairments leading into their adulthood years. Anxiety disorders have been underestimated in low and middle class due to the lack of medical resources. For contributing factors, I found that anxiety disorders can result in complex interactions of social, psychological, and biological factors. Anyone can have an anxiety disorder. Anxiety disorders are more related to people who have lived through abuse, severe losses, or adverse childhood experiences. Anxiety disorder can affect people's physical health. Many impacts of anxiety can cause muscle tension, nervous system hyperactivity, or harmful use of alcohol. And I'm going to talk about two interventions. I'm going to talk about cognitive behavior therapy and medication treatment. I'm first going to talk about cognitive behavior therapy. For cognitive behavior therapy, I found an article called Cognitive Behavior Therapy for Anxiety in Children and Adolescents. Cognitive behavior therapy is also known as CBT. Cognitive behavior therapy reduces headaches, outbursts, muscle tension, and stomach aches. Therapists use role-playing and relaxation techniques to help with children's identifying their coping strategies. CBT assists parents in responding appropriately to children's anxious emotions and behaviors while handling their own emotions. And this was an implicit study. There was 1,806 participants with mild to moderate conditions in community clinics and school settings. Children use a talking therapy with the therapist to help them find problem-solving skills. And then this is done within 9 to 20 sessions, and children are identifying their own emotions and coping strategies. Some goals I found within the article, they recognize their anxious feelings and body reactions to system to s- s- systematic reactions to anxiety. They clarify their thoughts and cognizance and anxiety-provoking situations. They develop coping strategies, evaluate outcomes. Contributing factors I found within the article, anxiety disorders are linked to autism spectrum disorder. And then ADHD and conduct disorders are linked to anxiety and depression disorders. And then some strengths I found within the article was it increases children's confidence in their schoolwork. And then therapists have found longitudinal reductions in anxiety diagnosis. And then this intervention lasted to 6 months to 24 months. For medication treatment, I found polysastic therapeutic drug monitoring for selective serotonin uptake inhibitors. Selective serotonin uptake inhibitors are effective for children with depressive and anxiety disorders. It's one size fits all. And then clinicians, they first start the child at the low dose, and then they measure the patient's tolerance with serotonin uptakes to see if they can encounter the different side effects and patients' responses to the medication. The medication increases patients' concentration, reduces anxiety or depression, and then it helps with patients gaining confidence within themselves. And this was the explicit study. It was done between ages 6 to 17 years old, and it was a population of 104 participants. And then some goals I found within the article was set a light on non-responsive and partial responses, understand drug interactions, evaluate inheritance, understand the impact of genetics and developmental abbreviations, and polykinesthetic genes. And then some contributing factors I found within the article was genetics, age-related changes seen in maturation, and then girls are more likely to have generalized anxiety disorder. And then this intervention lasted to 6 months. Overall, clinicians need to use the right dose on a client and over to see that the child gains confidence in their work, concentrate better within their environment, and then reduce anxiety or depression. And then for collaboration, social workers manage trauma of anxiety disorders by supporting the emotional support, practitioner assistance, advocating for the client, and finding the appropriate resources. And then social workers can communicate with parents and teachers to assist the child academically. And then as a clinician, you want to help the parent understand different anxiety disorders and how to respond to the child within different situations. You can offer counseling and emotional support for caregivers, and then connect the family to financial, social, and social assistance programs such as local food banks within the area. You can connect the family to a local food bank within their community. And then as a social worker, I would recommend the 504 plan to reduce the child's anxiety within the classroom. Some accommodations I would recommend was having access to a nurse or medication, breaks during and a lecture, and modified assignments. You may have the child do a recording of their presentation to reduce the anxiety within the classroom. And then lastly, I would refer the child and the parent to a psychologist to make sure the child or the teenager gets the right dose of medication. And that is pretty much all I have for you. I hope you enjoyed my presentation and thank you for watching.